Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel, founder of a revolutionary medical sales training and mentorship program called the Medical Sales Career Builder, and I'm also host of the Medical Sales Podcast. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire world. It doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing and diagnostic lab, you name it, you will learn how to either break into the industry, be a top 10% performer within your role, or climb the corporate ladder. Welcome to the Medical Sales Podcast. And remember, I am a medical sales expert sharing my own opinion about this amazing industry and how it can change your life. Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel. And we have a very special guest with us today, and his name is Aaron Kravitz. Now, Aaron is actually a sales professional for 3M in their acute care division. But what's so special about this episode today, and special about Aaron, is he actually was a nurse for a significant number of years that became a sales rep, medical sales professional, in a non-OR based role, and really into a space that a lot of nurses don't know they can go. But I'm not going to spoil it. I'm going to save it for the episode. As always, we do our best to bring you guests that are doing things differently in the medical sales space. So I really do hope you enjoy this interview. Hey, Aaron, how are we doing today?
Hi, Samuel. Doing great. Good to talk to you.
Absolutely. Why don't you tell the audience who you are and what you do?
So my name is Aaron Kravitz. I am an account executive for 3M Healthcare, and I manage a portfolio of vascular access products, disposables, for acute care setting hospitals, as well as some wound care products and other things such as that. So it's a great role that I have. I cover a pretty large territory. During implementations, things such as that, I can call on clinical folks that we have employed by 3M to come and assist with education. So I work kind of as a consultant for 3M. I see my role very much so as that.
I like it. So, you said a couple things that are really interesting. So the specialty is acute care. Give us just a definition. Acute care specialty encompasses what?
So acute care specialty is the large hospitals that we see. So inpatient hospitals, that's who my customer base is. There are roles within this that work with the out-of-hospital long-term care, home health agencies and whatnot. My specific role is that of the account executive for the acute care market in South Texas.
Got it. And so would you say that for your position, you're always talking to hospitals, or is it a mix of hospitals and clinics and other entities?
So always hospitals. So my call points in there, I help out infection preventionists, vascular access specialists, CEOs, different individuals who make product decisions that affect the whole of the hospital. So every patient that comes in.
Got it. And is it a team-based sell, or is this just you have your territory and you're pretty much the lone man responsible for taking care of it all? How does it all set up?
I see it kind of a franchise almost. So yes, I am the lone man. I am it. I have a director that manages a large territory with a lot of different sales executives, but South Texas is mine. I call on the folks. I make my schedule with them. And then, if there's a big change, if a hospital decides to purchase our product and needs education and big implementation, then I can call on a clinical team to come in and help do that. But a lot of the education I do myself. I take a pretty hands-on approach with that. Being a nurse, I talk their language. So
let's get into it then, because I think when it comes to nurses getting into medical sales, and I'm not going to say this is a fact, but I almost want to say that there's a sentiment out there that nurses believe they need to be in OR based roles. And I think that the reality is a nurse can provide an immense amount of value to any medical substance they decide to take. And when it comes to your space, acute care, I'm not even sure nurses realize that's an option for them.
So I think you're right.
Yeah. I want to get into, I want to explore that with you. And to kick that off, help me understand. So with this position, what's the day in the life? Let's say for all the nurses that are listening to this right now and thinking, this is interesting. Walk
Yeah.
us through a day in the life of being an acute care sales professional.
I think of it almost as being a nurse, and I'll tell you, there's a lot of things that, with that, the reason that I bring that up is, with nurses, we help patients make decisions every day. So in my daily life, I'm helping wound care nurses, vascular access nurses, supply chain. I'm helping them make decisions on what are the best products and how best to utilize them. And that's something that my nursing training really has helped me in my sales role, in that I'm helping people every day make the best decisions with what they have. I do a lot of, I can go in and do in-servicing, education to staff members, to hospital education directors. I can meet daily with a CFO to talk about a business plan. What is their purchases do? How is that affecting patient care? So a day in my life can be very variable, which is great. It's not the same thing every day, just like nursing. Not the same thing every day.
Sure.
I'm all over the
So
hospitals.
okay. How about this? What time are you getting up every day?
Oh, I get up early because I get up at like 5 or 6. I hit the gym.
Gym? All
Then
right.
I'm on the road.
Okay.
And it's variable. A lot of customers don't want to see you first thing in the morning.
Gotcha. Okay.
So I might be at a hospital. My first appointments usually are about 9 or 10 a.m.
Okay.
That's usually when my first appointments are.
Okay. And then what are we doing? Are we at that hospital for a number of hours? Are we in and out?
So a lot of times we're in and out. A lot of times I'm checking on the products that I support and sell, making sure that they're not having any issues. There's not any questions. If there are questions, I might go visit those individuals that have that specific question. So, not a lot of time. It's a couple hours in the hospital, and then I might move on to another facility. I cover a very large geography.
Right.
So that same cadence can be at different hospitals throughout my territory.
On the average, would you say you're hitting 5, 6 hospitals a day, 1, 2 hospitals a day, 10 hospitals a day?
It could be 2 to 3. 2 to 3 hospitals a day is pretty average for me.
And then for someone in this kind of role, are we coming home at 5? Are we coming home at 7? Are we coming home whenever we want?
Well, that's one thing. I've found just a wonderful work-life balance with this. It enables me to go, help with my son playing baseball. So there's days where at 3 o'clock I'm done. There's days that at 5 o'clock. If I have to travel, sometimes it might be, a little bit later. But there's some variability with that. But what's great about it is the ability to schedule that.
Right.
We have goals. I have my sales goals. I have my what I set and the expectations I set with my customers, and it's up to me to be able to plan that out. So if the day ends at 2 or 3, that's when it ends. If it's something I have to go back later and do some emails in the evening, I'll do it. But it's really a great work-life balance. So
I love it. I love it.
Yeah, it's great.
So let me ask you this. I want to go to a sales moment and get, indulge us here to give us your best. You're a nurse. You were a nurse, and that was what you did, and you were a nurse for a significant amount of time, so it's what you knew. So how you chose to operate. And then you became a medical sales rep. And one thing that when I talk to nurses, I always say, one cool thing about a nurse wanting to be in medical sales is, you're all about impact. Why would you have a job like this if you didn't care about impact? And with medical sales, you can make a larger impact for the mere fact that you can help more people than who's come into your hospital.
Sure.
With that being said, give us the moment when you realize that, wow, this is what I'm now doing is amazing. Now, as a nurse, you've seen a lot of stuff, man. I mean, you've probably seen,
Sure.
You could wow us. You could wow anyone I know, right? Anyone I know. But you still get a wow moment when you make a transition, and I want to hear that wow moment for you when you realize that, wow, I'm a medical sales rep, and I'm so glad I made it.
Yeah. So I know exactly when that happened, and it was very early on in the sales part of my career. There was a hospital system that was having a large amount of central line blood and stream infections.
Sure.
So I would work with them, and working with them and finding a product that would help them and a process that would help them.
Sure.
And being able to implement that and then come back months later and see that their infection rate dropped because of the product that I helped them implement.
Sure.
Yeah, that's a 900-bed hospital. That's huge. That's huge. These are thousands of patients per year. That was the aha moment for me. I was like, you know what? No, this is really good. This is really good. And a lot of that, I look back at that moment, and it's very much, I worked in a cardiac cath lab as a nurse. It was the same kind of feeling when somebody's coming in distress and they're having a cardiac event and we fix them and they walk out. I mean, that's huge. That is just, those are very, very similar moments. Their success. What you're doing is helping people. And I think as nurses, that's what we do. We help people. We might get frustrated at work, but we help people in this role as a sales executive. I still help people every single day, and more so maybe than I did, as a nurse. Sure. Working one-on-one with patients. I'm working, affecting a larger group of patients. It's great. It's great.
That is amazing. Okay, let's get into how you got here. So you were a nurse. Take us back. I want to. Okay, so we were, as a nurse, we can assume that you were engaged with medical sales reps. You were engaged with people that were in the space that you are in today. But I want to go back to where you said, I want to be over there. I
Sure.
want to do either what they're doing, or I want to do what I just saw, or I want to do that side of it.
Yeah.
Talk to us about that experience.
Yeah. It's great stuff. So nursing has been a great career for me. I worked in emergency rooms, intensive care units, various clinical roles that enabled me to, number one, affect patient care tremendously, just from being the nurse at the bedside in those front lines.
Sure.
And then as my career progressed as a registered nurse, I was in positions to where it started to look like we were making purchasing decisions, and clinical folk were starting to be brought into those discussions. It wasn't just supply chain and the CEOs and CFOs and medical directors. A lot of nursing now is involved in what's called shared governance, where they're sharing those types of decisions with the bedside nurses to ensure we all get, a say-so.
Sure.
So during that, a role came up for a position in value analysis, which was a clinical resource director role. And with this role, I kind of worked with finance, supply chain, other clinicians to help pick these products. What are the best products for our patients?
Sure.
So using my clinical knowledge, that's kind of where this transition started for me. Using my clinical knowledge, being able to see, okay, how much does this stuff really cost? Why does it cost this much? What's the evidence behind it? So being able to understand and being part of that process was really, it was great. It was a great pivot for me in a great position. But during that, I was also able to meet all of these sales executives, all of these reps.
And that's when you what? I need to be on this side of the
yeah.
Gotcha.
You build these connections and you get more information about the products that are at your hospital. And then your passion as a nurse to help more people can come into play.
Right.
And it did for me. And that's when I said, you know what? Not only can I affect one system, but I can affect a lot of healthcare systems.
Amazing.
So with that, I was able to make a clinical role for a healthcare company where I would clinically support their sales force. And then that turned into a sales role. I was good at. It was great. It was fun. I had a great passion for it, and it was recognized. So not only was I the clinical individual with the accounts, I also became the sales rep. And that's how my transition came from the bedside nurse to now an account executive.
Wow. Okay. So with you being the nurse that you are that's in this space, I want you to share with our audience, for those listening that are thinking about, I want to do what he's doing. I want to have his kind of career. I see what he's saying. And let's speak specifically to a nurse wanting to get into a non-OR based position such as
Sure.
what you're in now, acute care.
Yeah. Yeah.
What are three things that you would say this person that's listening right now should definitely have if they're really considering making this time?
Drive is number one. You've got to have it, and what that will allow you to do is open up your eyes, and you'll be able to see certain things that are happening at your hospital that you can make changes to and you can affect. Number two is really to dive in next and make yourself available. Once you have that drive, make yourself available. Let the management team know, look, I want to help with this process. I know that this is happening and this is an ill effect because of maybe a product decision or a process decision, but I want to help that. I want to be a part of that solution. And what that does is it opens up and it makes you you'll get new contacts and you'll find different roles in the hospital that you didn't even know existed that are involved with change. And the third thing is really to be a part of organizations outside of your hospital. So whether that's the nursing organization, the acute care nurses, I'm a vascular access certified nurse myself. Be a part of your Association of Vascular Access. Be a part of every facility will have be a part of some sort of purchasing group, and there is healthcare supply chain organizations. Be a part of as many of those as you can, because you get your contacts and you start to see there is so much that I can do to really help, number one, the customer, our patients, and the organization that I work for. So you're able to really have just a great career bringing all of those parts together. But it starts with that drive to make that change.
I hope you're enjoying today's episode. And I want to let you know our programs cover the entire career of a medical sales professional. From getting into the medical sales industry, to training on how to be a top performer in the medical sales industry, to masterfully navigating your career to executive level leadership. These programs are personalized and customized for your specific career and background, and trained by over 50 experts, including surgeons. Our results speak for ourselves, and we're landing positions for our candidates in less than 120 days in top medical technology companies like Stryker, Medtronic, Merck, Abbott, you name it. Would you run an Ironman race without training and a strategy? You wouldn't. So why are you trying to do the same with a medical sales position? You need training, you need a strategy, and you need to visit evolveyoursuccess.com, fill out the application, schedule some time with one of our account executives, and let's get you into the position that you've always dreamed of. Okay. And then on the flip side, and let's not necessarily negative, but if you're this kind of person, you probably wouldn't appreciate this type of role. What would you share? Top three things.
I think if it's a high adrenaline, kind of role, like you see a lot of times with sales executives that go into the OR, for instance, a lot of times they're very high adrenaline people. They're in cases all day. They're working with the physicians hand in hand. This might not be the role for that. This role that I have is much more laid back. It's a thinking role. It's a long sales cycle that we have. It might not be for the adrenaline junkie, if I can put it that way. This is a very laid back role. This is something that, requires a lot of confidence, because you are going in as very much as a consultant.
Sure.
And it's a consultant sales role. I really see myself as that.
Sure. Now I'm gonna bring up, before we wrap up here, I'm gonna bring up a sensitive subject and answer it the best you can. But nursing is, I find nursing rather challenging, because the job of a nurse is often similar across nurses throughout the country, but hospitals are dramatically different, and the pay range of a nurse is dramatically different.
Sure.
So you have these people, or some of them, like a travel nurse in California, living their best life. And then you have some people like just a registered nurse in Wisconsin, in a metropolitan area within Wisconsin, is kind of challenged. So I want to ask, what range, salary wise, can someone expect going from nursing to a non-OR based role?
That's a little bit difficult to answer, in that there are so many roles that are outside of the clinical nursing that nurses can do for vendor companies.
Okay.
It could be
Give me
a
the highest. Give me
clinician.
give me a range of the highest it could most likely be, or and maybe we don't even need to share the lowest. But what is possible? I guess that's more the question.
A lot of it is sky's the limit, and I can define that by there are many companies that have uncapped salaries. So it's a commission-based role, and there are many companies that have uncapped salaries. So you sell, your product is used, you continue to use it, you have an uncapped salary. Does that look like 500,000 a year? Maybe. Does it look like 3? Maybe. Does it look like 1 million? Sometimes. Depending on the space that you're in and the products that you have. But it is a commission-based sales role, and most of them are. And that really, to me, it's very exciting because it gives me the opportunity to plan my destiny.
But you still have a base pay component.
I do have a base pay, but I think the way that I look at my base pay, if I'm only making my base pay, I'm not doing my patients nor my company justice.
Ooh, that was well said, Aaron. That was well said. Okay.
So you get a base pay, but that's, again, I think if you're doing it for the money, I don't know. You got to do it for bigger. And for me, it's the patient and it's the growth of my company.
I love it. Last thing, as a nurse, you made a conscious decision to be in this space. For all the nurses out there that are relatively young, they've only been working less than 5 years, and they're realizing that they don't want to be here as much as they thought they could, and they're considering options. What reason would you say that they should look into medical sales?
Numerous, but the ones that stick out are, for me, are the work-life balance is tremendous. Earning potential is another one. Your ability to create your own path. You can do that with medical sales. There's just, you can really just pave your own destiny with it. And I think those reasons really drive you to this profession. And as nurses, you're going to be helping people more so than you thought possible as when you first started and thought, you know what, I want to be a nurse. The impact that you can have on patients' lives is tremendous. And I see it every day.
That's beautifully said, Aaron. Beautifully said. On that note, Aaron, we're going to bring this to a close.
Sure.
Is there anything else you'd like to share with the audience?
No, I tell you, Samuel, nurses that are not looking to stay in a clinical role and are interested in medical sales, medical device, pharmaceutical, whatever that is for them, do it.
Come on. All right. I love it. That was awesome. Last thing we'll do then is the lightning round. You have less than 10 seconds to answer 4 questions. Aaron, are you ready?
Let's do it.
Let's do it. All right. First question. What is the best book you've read in the last 6 months?
Oh, goodness. Sales Truth. It's a Mike Weinberg book, excuse me. And it brings it back. There's a lot of different sales strategies and things, and it really brings it back to the basics. And again, I'm not trained in sales in a manner that is, from any schooling. So I do a lot of research on sales. It's truly an art form, and it is truly something that interests me. So as a nurse, I read a lot of sales books.
Hey, come on. Sales Truth. I'm going to check that out. All right. What's the best TV show or movie you've seen in the last 6 months?
Equalizer 3. I'm a big Denzel Washington fan.
Come on.
So
Me too.
Denzel Washington's it. He is, to me, like, the guy's just incredible. So any movie with him is great. So
that's awesome. I couldn't agree with you more. Okay. Best meal you've had in the last 6 months. We want the restaurant and name of the
The meal was Battalion, which is there's a lot of great Italian restaurants, and San Antonio has a lot of great food and usually a lot of great Mexican food. But my wife and I ate at a restaurant called Battalion, which is a Italian restaurant that is in an old firehouse.
Ooh, okay.
And I had the lobster ravioli, and it was on point.
Woo.
It was
Okay,
good stuff.
Check it out. Next time I'm in South Texas. And then last question. What is the best experience you've had in the last 6 months?
Watching my son hit a home run in his Little League baseball.
Hey.
To me, it lit up, and it just showed, there was other kids on base, and I think, the coach said it best when afterwards he was like, the other kids came in and he was like, we win and we lose as a team, and today we won as a team, and Jackson led that team. And I think that was the moment where it's like, man, that's great.
How old? How old again?
He's 9 years old.
I have a 9-year-old.
And it was that was the moment. That
is amazing. That is amazing.
Sticking out.
How many, is he only one, or how many do you have?
No, I have 3 sons, actually. Oh, wow. Yeah, 3 sons.
What
2 of them in college, and my youngest is 9.
Wow. I have 2, 14 and 9. 9's a special age. That's a
great age.
That's a great age. That is fantastic. Well, congratulations to him.
Thank you. Thank you.
That is absolutely wonderful. Real quick, did your sons, other 2, go into medical sales?
They're in college right now.
Okay.
And they are seriously looking at that.
Wow.
So they're both in college right now. They've seen the wonderful life that I've been able to provide for them.
Sure.
The happiness, it's just, again, Samuel, I don't think I could ask for a better position in life right now. And for your sons to be able to see that is pretty special.
Amen to that, Aaron. That's beautiful. Aaron, it was a pleasure having you on the show. Fantastic learning about acute care space. And thank you for coming on the show today.
Great, Samuel. Thank you for all you do.
Absolutely. And that was Aaron Kravitz. Fantastic stuff. What I love about this episode is he really loves what he does, and he really took the time to understand how he can make a bigger impact leaving nursing. And he's created such a career for himself that all he wants to do now is give back and show other people the opportunity they have if they're a nurse that no longer wants to be doing bedside care. And of course, it's 100% aligned with what we do here at Evolve Success and why we bring you these messages so you can see what the opportunities are for you. So if you're a nurse out there and you listen to this episode, then you should know what I'm going to say, but I'm going to say it anyway. I want you to go to evolveyoursuccess.com, go to the page, select the application, fill out the application, and send it in, and schedule some time with one of our account executives. Interview with us to see if our program is a good fit for you, and we can get you into the medical sales position just like Aaron. As always, we do our best to bring you guests that are doing things differently in the medical sales space. So make sure you tune in next week for another episode of the Medical Sales Podcast. I hope you enjoyed today's episode. And remember, I have a customized and personalized program that gets you into the medical technology industry as a sales professional, or any type of role for that matter. Become a top performer in your position and masterfully navigate your career to executive level leadership. Check out these programs and learn more at evolveyoursuccess.com by visiting our site, filling out an application, schedule some time with one of our account executives, and allowing us to get you where you need to be. Stay tuned for more awesome content with amazing interviews on the Medical Sales Podcast.